Good morning or good evening, wherever you are. My name is Dr. Paul Gabriel. I'm a practicing anesthesiologist in Illinois, United States of America. I've been practicing here since 1998, and I just want to add a simple idea that help you during this COVID pandemic. The whole idea behind the mask that I adapted to health protection is for protecting yourself, protecting your future patients, and protecting your family as well, and decrease the spread of the pandemic, since as a medical provider you can be a source or focus of infection. The whole idea is the simple snorkeling mask. This snorkeling mask was adapted by Italian doctors to be used as respirator/ventilator. So I bought this mask from Amazon.com. You can buy it from whatever source. I'm not making any advertisement for any company. The mask that I bought is simply has a circular opening here. The whole idea is when you fit the viral filter, it makes a good seal. There are some masks with oval opening. You need either to have an oval filter or to adapt it somehow, but it's much easier if it has a circular opening. The mask comes automatically. With this, the shoes usually fit on top, so when you snorkel, it's good. But what we're going to do, we'll remove this area here, remove this plastic part here, and it's attached by an elastic band, and now you can see the mask is free. After I put the mask, I just want to confirm something or stress on something, that once you want to make sure that there is no air and it's airtight if you close it up here. So I have three kinds of filters that we had from the anesthesia department at our hospital. This is called Brentwood Spiro Scan Bacterial/Viral Filter. It's green. Any filter, as long as it fits on top of here, will be good. The second filter here I have is called VB Max filter, and it's blue in color. And the last filter is the filter that we fit on the anesthesia circuit, and I guess this is very easy to find. What I'm going to use today is the anesthesia circuit filter, since it's light, but you can use any filter. I don't really mind. So what you do is you put the filter on top of the mask and try to bring either a piece of plastic, like any piece of plastic, or you can bring any piece of Tegaderm and try to put it around to make sure it's sealed well. So what I'm going to do here is I will put this plastic around and make it tight, as tight as I can. And okay, it's not working fine, so I'll refer back to the Tegaderm. So I'll put a piece of Tegaderm around this area here. Let me just open the Tegaderm quickly before we move forward. I'm having a little difficulty. Here we go. So I'll put the Tegaderm around, then put the filter, then make sure it has a complete circle around the filter, and I can remove this part, the paper part, remove it, and you can use different kind of Tegaderm, and again remove the rest of the paper and make sure it's around. Then you bring any kind of tape, whatever you have in the hospital, and you put it around here to make sure you have a good seal. So I'm gonna go a couple rounds around this. The whole idea is not the look, because the look may be funny, but the protection. I know it may look not the best, but it's protection. Once I have the mask on, that's how it looks. I'll put my hand here to make sure there is no air leakage, because otherwise it is of no value. Of course, if you are wearing glasses just like myself, you need to take off your glasses. If you need to wear contacts for ease, it will be much better. I have contacts, but I'm wearing them today. So you take off your glasses, you put the mask, and sorry, my voice will be muffled. As you saw twice, I tried to take a breath and I couldn't, and I felt the mask really pressing on my face. Then when I let go the top of the filter, I was able to breathe. Your voice may be muffled, so if you need to do any interview, please make sure that you do the interview before you put this mask on. This mask is mainly if you're in the hospital all day long with patients with COVID. What I want to stress too, this is a difficult time for you and for the patient. Be of positive spirit. If they need to pray, with you, pray with them, encourage them. You're protecting them and protecting yourself. Also, it's a quick tip for those who do not work in the hospitals and work around patients with COVID, either at house or a nursing home. You can simply buy those filters. They're called the CPAP filters. They are sold on stores and on Amazon as well. It comes a 52 pack. It's a rectangular filter that if you don't have the filters that I showed earlier, you can basically use one of these filters, fit it on top, and use it for protection. Also, one more thing for doctors, if you have the N95 mask, you can actually put the N95 mask be under the snorkeling mask. So I'm gonna do a quick demonstration. So I have the N95 mask. I'll put it on. Make sure it is nicely fit. Then on top of it, you can easily put the N95 mask. That's a double protection just for your safety. And I think it's a good idea, and it may look funny, but it's very important.